Good afternoon, everyone. I'm Dr. Akhila, consultant fertility specialist, Sudha Hospital, Banjara Hills, Hyderabad. Today, we're going to talk about hydration and fertility. How hydration helps in fertility, what are the causes, and what does dehydration do? So, let's quickly understand that water is said to be the essence of life. So it is the major component of every cell in our body. Almost two-thirds of our body constitutes of water. So that is the importance of water in our body. And staying hydrated not only helps in reproductive functions but also on the overall well-being of the body. Let's understand how hydration affects fertility. Now, we all know that hormones are the messengers of the body and they help in orchestrating the various functions of the body. So, once the hydration is less, the function of these hormones also gets affected. So, in women, the cycles can become irregular, ovulation can get affected, and menstruation also gets affected when there is dehydration. And it also dehydration also causes inflammation. So once the inflammation sets in, the chance of getting pregnant also decreases. The cervical mucus gets affected once there is dehydration, so it plays a pivotal role in the sperm transport, so that also gets affected. In males, due to electrolyte imbalance because of dehydration, the sperm counts get affected, the motility also gets affected. So these are some of the things that can happen once dehydration sets in. And how do we know that there is dehydration? What are the signs of dehydration? Importantly, there is thirst and urine can become darker. That's one of the early signs that we know. Tiredness, fatigue, headache. These are some of the symptoms that we can experience once there is dehydration. Also, hydration is something that is quite there's an immediate and a direct effect. So, drinking water immediately changes a lot of things, and we approximately about 8 to 10 glasses of water is what we usually recommend for everyone to drink on a daily basis. That amounts to about maybe 2 to 2.5 liters of water. So, and water is not the only way of keeping yourself hydrated. So, there are fruit juices that you can drink to keep yourself hydrated. Certain vegetables like cucumber, salads, green leafy vegetables. So, all these also are watermelon, oranges. So, these are some of the vegetables and fruits that you can eat regularly to keep yourself hydrated. And dehydration basically causes not only issues in fertility, like I already mentioned, but also on the overall well being. So, staying hydrated, having a regular, balanced diet, regular exercise, good sleep, these are some of the things that are of paramount importance once it comes to reproductive health. So this is in short about what how hydration can help in fertility, and what do we do to keep ourselves hydrated? How do we know that dehydration is setting in? So, any questions, please? Does water increase the sperm quality in men? Quality per se, we don't have any test to check the quality of egg or sperm. But staying hydrated improves the electrolyte balance, it improves the sperm counts, the motility, and that's how we can understand that maybe the quality also improves. Can you please tell us what will happen to the egg if more amount of water is consumed? So, like I said, water is an important component of hormones. And now, what do hormones do? Hormones are the messengers of the body. They orchestrate or they signal a lot of functions in the body. So, once there is hormonal imbalance, that's when the cycles get irregular, ovulation gets affected, and fertility gets affected. Not only that, the gametes, the egg or the sperms, they move in the body in order to meet each other. So once the hydration is less, this movement also gets affected. The cervical mucus gets affected. So the sperm transport gets affected. There could be vaginal dryness. So intercourse in itself could be a problem. These are some of the factors that can cause fertility because of dehydration. Is it true that water flushes out excess estrogen from the body, which can cause hormonal imbalance? Uh, Not really. So, like I already said, hormonal imbalance is because the water content in each cell is what gets affected. The hormones get affected. It does not drive out the hormones. Do intake of water result in increased amount of cervical mucus? Not increased amount, but adequate amount is what it is. Dehydration causes cervical mucus to get affected. So staying hydrated helps in keeping it at a balance, keeping the cervical mucus adequate. More water doesn't mean more cervical mucus. Thank you very much.